Thank you so much for joining us. My name is Amy McCallion, and I'm the chair of the Alzheimer's Society of BC's Board of Directors. Welcome to Opening the Door, Why Families Are Essential to Care. Before we begin, I'd like to acknowledge that the Alzheimer's Society of BC operates on the traditional, ancestral, and unceded territories of Indigenous peoples around the province. Our provincial office is located on the territories of the Musqueam, Squamish, and Tsleil-Waututh peoples, with regional resource centers located on traditional territories in all regions of BC. Our vision for a dementia-friendly province, one where people living with dementia and their caregivers are welcomed, included, and supported, will only be possible through ensuring that everyone living on these territories has access to support that is culturally safe, barrier-free, and free from Indigenous-specific or any type of racism. Today's event is part of Alzheimer's Awareness Month, which is recognized across the country each January. Alzheimer's Awareness Month is an invaluable opportunity for us to have important conversations about issues that are relevant to families affected by dementia. It's wonderful to see so many people joining us from around the province today, and I'm very grateful for your participation. To get us started today, I'd like to hand things over to our host and moderator for the day, who's Global BC News anchor, Jordan Armstrong. Jordan, over to you.
Amy, thank you so much. And it's such an honor to be asked to participate today and to speak to such a wonderful organization. I'll acknowledge before I get started that I'm speaking to you today from the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Before we begin, I'd also like to thank the Wavefront Center for Communication Accessibility for providing ASL interpretation and the closed captioning for today's event. If you need to take advantage of ASL, make sure you are using Gallery View and just pin our interpreters, Jess Carroll and Bree Kwan. Today's event is being recorded. If you are running into technical challenges, Dave from McMedia is online to help. Please use the chat box to send him a private note. As Amy noted earlier, Alzheimer's Awareness Month is an important time to shine a spotlight on issues affecting families living with dementia. Today, we are talking about the role families play in providing care for people living with dementia and why their role is an essential one. We will be hearing from community members who are affected by dementia, who will share stories and ask questions about how to address the challenges being faced by families. First, when a family member living with dementia is still at home and needs support from community resources. And second, when someone has transitioned into long-term care. Regardless of whether the person is at home or in care, families absolutely need support to provide care. This was true before the pandemic and is even more true now, with community resources limited and access to long-term care restricted for so many. Today, we are pleased to be joined by our panelist, Jen Lyle, the CEO of the Alzheimer's Society of BC, Isobel Mackenzie, British Columbia's Seniors Advocate, and our community members, Myrna Norman, an advocate who is living with dementia, who will be introducing the topic of community care. As well, Erin Craven, an advocate and caregiver, who will be introducing the topic of long-term care. Before we get started, I wanted to encourage everyone to use the chat box throughout the event to share your experiences and questions. And if there is time, our panelists will be able to respond to a few of them, or someone from the Society will follow up. To start us off, I'd like to welcome Jen and Isobel to offer some opening remarks. Jen, perhaps you'd like to start us off.
Thank you, Jordan. And I'm honored to be joining today from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. It's wonderful to see so many people joining us here today for this vital discussion as part of Alzheimer's Awareness Month. In fact, I think we're over 200 right now. And I'd also like to recognize that we're being joined today by Shirley Bond, the interim leader of the official opposition, MLA for Prince George Valemount, and critic for senior services and long-term care. And I'd also like to welcome participants who are joining us from a number of different areas, including the health authorities, care providers, other organizations, and of course, those of you with a direct connection to this issue. As Amy mentioned, here at the Alzheimer's Society of BC, our vision is for a world without Alzheimer's disease and other dementias, and that begins with a more dementia-friendly province, where people who are affected by the disease are welcomed, supported, and included. To make that world possible, though, we need to change about how we collectively talk about dementia and what we do. And that's why discussions like the one we're having today, where we talk about what people are experiencing, we hear their stories, and we talk about how we can begin to address these issues, are so important. Today's topic is focused on the essential role that families play in providing care for people living with dementia. And since the pandemic began, we've heard that word essential over and over, especially when people are talking about restrictions around visitation for long-term care and assisted living. Who is or who isn't deemed essential has become a hot button topic for a lot of families in BC. And while we'll be talking later about long-term care, today's discussion is about the essential role that families play in providing care throughout the journey. When people living with dementia live in the community, their family and friends are responsible for whatever they needed at that point in their journey, including identifying the often limited community supports available to meet their needs. When people transition into long-term care, many families may feel like they've been taken out of the equation altogether. Now, families can look very different for everyone. Caregivers might be partners or spouses, they might be children or friends, but regardless of who they are essential to providing support for people living with the disease. And all families, no matter what they look like, deserve support from the community to be able to provide that care. They deserve to be seen as partners in care as well, valued for the knowledge and understanding of the people they're supporting. They bring this knowledge and expertise when they work with healthcare providers. At the end of the event, we're going to be launching a survey focused on the impact of the current long-term care restrictions to better understand what families are experiencing. And so I'd encourage you to take a look at that survey and even to share it within your networks, because we look forward to hearing people's stories. And now I will pass the virtual mic over to Isobel.
Thank you very much, Jen, and welcome to all of you. And as we start today's discussion, what I'm reflecting on is the reference to the disease and people living with the disease of dementia and Alzheimer's. And that's true. Just as people live with other diseases, people live with cancer, they live with multiple sclerosis, they live with heart failure. And those people, like people with dementia, all have retained their fundamental rights around getting what they want, when they want, being with who they want. And at the very core of when we look at the rights of people with dementia, we've got to examine what we are implicitly saying when we are telling families that we will decide, the system will decide for your loved one whether or not you are essential, which is what we saw happen in long-term care. And the tragedies that unfolded from that are many, and the stories are heartbreaking, and time was lost, precious time with family members that can never be recovered. And while it's a story of COVID, it really is a much deeper story. And it is a story about how we view people, older people in part, and particularly older people who have a diagnosis of dementia or who have behaviors that we believe are dementia. And that is that we take over their decision-making for them in all domains. And I think that we need to take a step back and recognize and realize that people, when they cross that threshold into long-term care, surrender a lot of personal liberties. They surrender a lot of their rights of self-determination about when they're going to eat and what they're going to eat and who they're going to eat with, and what time they're going to get up and when they're going to go to bed, to a large extent. But they don't surrender all their rights. And the most fundamental right that any of us should be able to retain at any stage of any disease progression is the right to determine who we want to spend our time with, our precious limited time with, and that we have the right to say who that person is, whether we're living in a long-term care home, whether we're living in our own home in the community. It really is something that is very fundamental to moving forward and embracing a dementia-friendly world, is to recognize and understand that people with dementia are people, and they want to be with the people they love, just like everybody else. And we have to recognize that. And I am very much looking forward to the discussion today and from hearing from all of you. Thank you.
Thank you so much, Isabel and Jen, for your opening remarks. And now we will be starting the discussion itself. For the first part of today's conversation, we'll be talking about the issues facing families when the person living with dementia is living in the community rather than in long-term care. To introduce this topic, we've invited Myrna Norman to talk about her experiences. Myrna is an artist, writer, and outspoken advocate who is living with dementia. Since her diagnosis in 2009, Myrna has been working to raise awareness of dementia, changing people's perceptions of what it means to live with the disease and build dementia-friendly communities. Myrna participates with many projects and organizations, including the Alzheimer's Society of BC, of people living with dementia. Myrna, I'll give you the mic.
Thank you very much, Jordan. It's a pleasure to meet you. I have to start off by saying, holy smokes, Isabel. This is a major breakthrough for people living with dementia. That it isn't a course that we must take, that we're people that we have rights to make decisions. And for anybody that watched yesterday's webinar on the Alzheimer's channel, Krista James talked about rights that are not automatically taken away from people with dementia. And we all must know that. That's really important. Anyway, I'm thrilled with what you had said. So as Jordan said, I was diagnosed in 2009 with frontal dementia, frontal temporal, and given 8 years to live. I'm decidedly past 8 years, and I know a lot of people who are in their 20th year. So it isn't an automatic death sentence. We can learn to live well. My dementia has gone through many phases. I'm a passionate advocate for people with lived experience. With the support of my family and friends, I spend about 6 hours a day every week, and occasionally weekends engaged in advocacy and other community activities. I really believe that this engagement has slowed the progress of my dementia. I want everybody to hear that. Don't misunderstand me. I have really bad days and I have really bad tempers. I have a lot of problems with word finding. I often ask my husband to put something in the freezer when I'm in the oven, etc., etc. I lost my driver's license. My doctor removed that about 7 or 8 years ago. I suffer from exhaustion sometimes. Boredom I used to, but now I am so busy that I'm not often bored. And recently I have learned that I can be happy and live well with dementia. The one thing about dementia that's most disturbing to me is I can't remember the last 10 minutes. So that can be kind of troubling. Did I take a pill or did I not? That kind of thing. But I met 2 women from UBC, Dr. Praveen and Dr. Cox, and they unlocked something inside of me. I started to do arts with them, and they somehow helped me to find myself and helped me to learn that it was okay to live well, that we didn't have to remain feeling so badly that we were dying because we were missing all that time when we wanted to be living. Gratitude to them is an understatement because as a society, we continue to stigmatize people with dementia. People don't know how to act around us or how to communicate with us. And my brief story is one time a medical doctor said to me, "You don't look like you have dementia." And I said to him, "And you don't look like a doctor." And that has to be what we explain to people. Because of stigma, people living with dementia don't always know that living well, being happy, and being part of the community are possible. I'm on an action group connected with UBC researchers who have put together a flipping stigma toolkit that has launched this month. Look it up online. It's called flippingstigma.com. Part of my advocacy has been in-person memory cafes in my community. My husband and I work with small groups of people along the journey. Dave talks to the caregivers, and I talk with the people with dementia because that's where I am. It's unfortunate the Alzheimer's BC can't give us the names of people that were in support groups before they became viral, because we do in-person support groups, and I don't have funds to get the word out. So it's just a shame. I understand that it's a privacy matter, but wouldn't it be nice if somebody could call all the people that used to be in support groups and let them know that there are support groups out there for them? Last year, or the last 2 years, we've had a Christmas in July down at our local park. Great fun. I know, however, I've been aware of the challenges of caregivers. I know of 2 caregivers in my own support group. They can't afford to pay for respite and are totally mentally and physically exhausted. Which of them will succumb to the stress of this unfathomable responsibility? And why the hell aren't we helping them? Both of their husbands are in late stage and require constant care. And they still come to support groups, and I can just see them, the caregivers, wasting away. Why do my husband and I have to bear all the costs of offering friendship and education? Like, where are the other services? Community support such as respite and adult day program were already scarce and underfunded before the pandemic. They were often not tailored to the unique needs of people with dementia. Day programs are often geared toward one age group and don't speak to people who have young onset dementia or have different types of dementia. COVID-19 suspended anything in person, and to this day, we're waiting for things to resume, other than what we've done from the grassroots. And where is home support? 4 hours a day is the maximum you can get. That's 28 hours a week, which is just over a day. That means family caregivers at best are solo 6 days a week. This is worse than COVID-19. Jen and Isobel, I have some questions that I'd love to hear your thoughts on. The first question is, how do we address the stigma about the disease and educate people to better support community members living with dementia?
Well, I think we take you on the road, Myrna. It's where we start with breaking the stigma of dementia and Alzheimer's. I think we do it by continually reinforcing that dementia is a disease, yes, but so are many things.
Mm-hmm.
And people progress at different rates, and the end looks different for different people. And it's funny, you talk about your diagnosis in 2009 and you were given 8 years, and you've obviously defied the odds. Think of the many people who are diagnosed with cancer and given odds that they beat, and the Hail Mary pass that many people pursue in treatments, and usually they don't work, but sometimes they do, and that there is not an inevitability. There's the inevitability of death that will come to us all, but the inevitability of a trajectory is not absolute, and it's challenging. In the healthcare system, we tell people all the time, oh, they won't survive this, and oh, they'll suffer this, and we say it with an absolutism that's not actually borne out in reality. Usually and always are two different things, but we do tend to put the usually in the box of the always. And I think this issue of rights is fundamental, and the ability to your decision-making capacity is in domains, and I would work with people. This is in my previous role in the community with clients, home support clients over time. And, in the beginning, lots of domains of decision-making remained, and some changed over time. And frankly, some didn't. But I think, the reality is that there are very, very few people actually who progress to the point in their illness where they are actually unable to voice an opinion about the very day-to-day things like, I like this food, I don't like this food. I like this, I want to spend time with this person, I don't want to spend time with this person. Most people retain those fundamental abilities to the very end of their journey. Not all, but most. And we need to remember that.
Thanks.
Thank you so much, Isobel and Myrna. It's been lovely to meet you virtually, Myrna. Let's open it up to Jen and Isobel to talk through the role of families in community care and the challenges being faced. Jen, maybe we can start with you. How do we address the stigma about the disease and educate people to better support community members living with dementia? I look forward to your thoughts.
Yeah, thanks, Jordan. And I was thinking too, Myrna, I laughed about your comment about the doctor saying, you don't look like a person who's living with dementia. Well, you don't look like a doctor. But I think that's really telling. We talk about stigma, right? One of the things that I think is very powerful that we can do is to do just that, to talk, to take dementia out of the shadows. We don't have this stigma around cancer. We don't have the stigma around diabetes. We don't have the stigma around heart disease. Why do we have this stigma around dementia? Why do we approach this with a fatalistic attitude? Why are there so many misconceptions about it? And so I think having discussions like the one we're having today is vitally important to addressing stigma. And to your point, Myrna, not just about how we can live with dementia, but live well. I think that's one of the major misconceptions out there, is the idea that life ends once you receive a diagnosis of dementia, and that's just not true. I mean, you're living proof of that, Myrna. So I think the more we can talk about it through things like Alzheimer's Awareness Month, which is where we are right now, the better. I know one of our campaigns our campaign this year is focusing on that concept of don't change. Myrna, you talked about how community members don't know how to support somebody in their life, or suddenly we learn that somebody in our life is living with dementia and we stop inviting them to dinner, or we just don't know how to act around them anymore. So things like those awareness raising campaigns, the don'tchange.ca campaign we're running this month, are important to addressing the issue of stigma and pushing back on those misconceptions that people have. And ultimately, I'll underscore this, sharing the experiences of people like yourself who are living with the disease, so that we can further push back on those misconceptions and myths that people have. The last thing I'll say on that too is that more voices are powerful. And so we see this in partnerships. When we can partner together to do more, our impact is greater. And I will note that in addition to the campaigns the Alzheimer's societies across Canada are running this month, we also have the Public Health Agency of Canada similarly running a campaign around creating dementia-friendly communities. So I think all of those initiatives help address the issue of stigma. But to your point, Myrna, we still have more work we need to do.
Great, thank you, Jen. Isobel, what are your thoughts?
Well, I would echo to a large extent what Jen has been saying, that I think probably what we're going to see as we move forward is growing sophistication around diagnosis. So one of the things, if we think about 20 years ago, the misdiagnosis of delirium and other transitory cognitive impairments, we're getting better and better at that. And there's growing evidence actually that the probability of developing dementia is reducing, and we don't know the degree to which that is because we have better diagnostic tools, and the degree to which generations that are coming forward have less of the risk factors, because we're not conclusive on what those are. But I think as more people experience it in their own life, so the generation, the boomer generation, is now experiencing aging parents to a greater extent than we've ever seen before. People didn't live as long, and so their adult children didn't go through the aging journey as much. And they're going to see, what is the Tennyson poem Ulysses, though much is taken, much abides. That you start to see when you are a close family member of somebody with dementia that certain things recede, but not everything, and there's more abilities than there are deficits in many circumstances, and that will inform us all. And so we'll start to realize, when you're sitting with the doctor, the daughter and the mother, the daughter, talk to my mother, she's the patient, don't talk to me, sort of thing. We're going to see more of that, and it will, I think, increase this understanding of the uniqueness of a dementia diagnosis. It's different for everybody, and it looks different in everybody. And I think that that's part of it. And I mean, Myrna is an example. I mean, it clearly looks different in her than the stereotypical. And it's unclear, a lot of people's stereotypical opinions of somebody with dementia are not actually as stereotypical as we might think.
Isobel, thank you. To live well in the community, people living with dementia and their caregivers need daily community supports, respite, adult day programs. So where do we need to start to address the growing need? Isobel, let's start with you on this.
Well, it's interesting. I'm just, we're doing our annual monitoring report, and it's quite stunning because the year we're reviewing is the first full year of the pandemic. And you talk about 8 adult day programs. There were 6,000 people who would normally have had adult day programs for a year that didn't have any. And what did that look like, and what was that impact on the community? But I think the challenge that I see, and I see this, certainly saw this in my professional life before my current role, is, and it's part of this underlying, again, the system wanting to control things for people rather than giving them the tools to be able to control for themselves, is that I think people, particularly those with family members, when equipped with understanding what it is they need to do and given support, sometimes it's financial support, sometimes it's coordinating support to do that, can thrive. Others don't have those family members, and the system has to come in and do those things for them. But what we have really in this province is we want to control everything that you provide or do. The home support program and the respite program being a classic example. We dictate when you're going to get the respite, how many hours, who is going to come, and what they're going to do during respite. Instead of saying, we understand you need some respite and we can do this a couple of ways. We can provide you with some funding. You can arrange your own respite, or we can provide the respite for you. It's that challenge in the community. There's a big missing piece. For some people, it's the financial piece. For some people, it is they need a lot more help just getting everything lined up in the beginning. And if they could do that, they can then manage. But we almost set it up for failure. We just hand people a list of who they should call and what they should do. And I think we've got to come back to what case management really is intended to be. It's not case referral.
Thank you, Isobel. Jen, your thoughts on this?
I think Isobel did a great job of addressing the nuances around this issue. And I think for me, sort of the key thread and the takeaway on this issue is that the most important step to ensuring that people have their needs met is to ask them what their needs are and then to listen to them. Because, Isobel alluded to this, everybody's situation is different. And yet we've designed a system that attempts to shoehorn people into the same box. Myrna, your example, your experience of young onset dementia is a great one, because presently right now, if you have young onset dementia, a day respite program for a couple hours is not going to cut it, because chances are your spouse is still fully employed. They're still in working age. So how are they going to be able to then become a full-time caregiver for you, or even just be around to provide the support that you might need, because maybe you're not able to stay at home by yourself independently. And yet the programs that we have right now don't amend themselves well to those circumstances, those contexts. So that's what I like. Ultimately, what this means is I go back to, if you want to understand the need of the people, ask them.
Thank you, Jen. And to touch on something raised by Myrna, how would you start to address the challenges people experience rather with home support? And Jen, maybe you can give us your thoughts on this first.
Yeah, I mean, it's a big issue. And I would say, first and foremost, I would strongly encourage anybody who's not connected, who's affected by dementia, who's not connected already to First Link, to get connected with us. Now, the First Link program is a great source of education and support, but we can also serve as navigators to help connect you to the resources that you need. Myrna raised a lot of good points on this one, so I'll focus on two in particular, just in the interest of time. And firstly, it's to recognize that we need better access to home support services. And I noticed a question around the Ministry of Long-Term Care, for example, came up in the Q&A panel. I just want to caution us against focusing in too intently on long-term care reform. I know that's a hot topic right now, and rightfully so, but we need to recognize that the home support system is absolutely vital in enabling people to remain at home longer, and quite frankly, reduces the overall demand for long-term care. So I think it's really important that we don't get tunnel vision on that issue and lose sight of that. And there's a role for the Alzheimer's societies to play in that. The other thing too that I want to pull out as well is just the challenges around training. We know that there are challenges with regards to ensuring people working in the home care and home support sector are trained and educated on dementia-friendly practices. And that's something that the society can support on, in providing that foundational dementia education to people working in home support, so that they have the tools and knowledge to provide better support to the families they work with. And even just looking forward and anticipating the future growth and turnover in this workforce, that will become increasingly important as time goes forward.
Thank you, Jen. And now let's move on to the challenges faced by families of people living with dementia in long-term care. To introduce this topic, I'd like to pass the mic over to Aaron Craven. Aaron is a Vancouver-based actor who has been a caregiver since 2016. His experiences have motivated him to become a passionate advocate for families on the dementia journey. Aaron, over to you.
Thank you, Jordan. And let me just say, Myrna, if this was an in-person town hall, I would have led a standing ovation for what you said. But because we're on Zoom, I'll just say thank you for everything that you said. My journey as a caregiver and family member of someone with dementia began in 2016. I'm one of those rare family members who gets a diagnosis for both their parents simultaneously, which, needless to say, was shocking. My dad with vascular dementia, my mother with Alzheimer's. My dad's journey was quite quick. He passed away in 2018, and my mother is now in long-term care in the late stage of Alzheimer's. Those of us who have family members who are dealing with parents in long-term care, we face many challenges, amongst them the difficulties of transitioning to long-term care, which was certainly a problem for me. My mother, as some of you might have read in the papers years ago, had a really bad incident when she was admitted to St. Paul's Hospital. We were trying to transition her to long-term care, and needless to say, it didn't go well. And that started me on my journey as an advocate and working with the Alzheimer's Society of BC. Definitely some of what's been said today, a lack of resources for dealing with the sudden change of lifestyle, financial circumstances, the challenge of managing a power of attorney, which is something that I've spoken about many times. When you're just busy with the business of transitioning a parent or a loved one into care, with all that entails, then having to use a power of attorney for every utility bill and every single avenue you travel to try to close up affairs. It's very difficult. And a general lack of informed dementia knowledge in the healthcare system. These were all challenges that existed prior to COVID-19, and of course, COVID-19 has amplified these issues. The biggest one being the very muddy waters of the essential visitor status. Currently, I'm one of the lucky people who the care home that my mother's at has determined that I'm an essential visitor, but the definition has been problematic from the beginning. And I discovered that when during a period of lockdown, when I looked into it and looked at the definition of what an essential visitor really is. And the definition really focused on the physical needs of the resident, and there was very little defined about the mental health needs. And I just want to bring up a picture because a lot of the news coverage of people that are, restricted from visitation, the news will show sort of a picture of a forlorn looking elderly person in a window at a care home. That's very negative. But I want to show you what the opposite looks like. And that's me visiting my mother this Christmas. And that's what joy looks like. And that's what is the essential quality of a family member supporting someone living with dementia. It really, that old saying, a picture says 1,000 words. It's as simple as that. Part of my advocacy has been to work with healthcare officials to define family members as knowledge givers, as partners, as stakeholders, as essential mental health practitioners for their loved one. And so the issues of that have been raised during COVID-19 are tragic. And I think if we don't reconcile what essential really means and reconcile what we're currently doing with the essential visitor status, I don't think history is going to look back kindly on us. And a few of the other things that are problematic currently, the rapid testing situation. Rapid testing was something that was talked about early in the pandemic, and we haven't really seen it implemented at care homes. In a lot of situations, the staff are randomly tested if they have symptoms, whereas family members have to test every single time they come in. And this isolation that people are feeling, I could definitely see the cognitive decline and the mental drop-off with my mother during periods of lockdown. And so here's some questions that were tabled in my discussions with Ben and Katie, and this is for Jen and Isobel. How would you prioritize addressing the many challenges currently facing long-term care, including issues with resourcing, lack of supports for families making that transition? Number two, how do we address the massive costs, financial hardship, stress, time, and the lost moments together that families with someone living in long-term care have had to shoulder because of this pandemic, because a lot of the collateral damage, of course, is left with the families. And Isobel, your report, Staying Apart to Stay Safe, which was released in November 2020, examined the impact of isolation on residents, including increased loneliness, depression, and rapid cognitive decline, all of which I've seen firsthand. The report puts forward the recommendation that everyone in care should have one essential visitor, as well as the idea of family councils. So could you please walk us through the benefits of these recommendations? And thank you for having me.
Thank you so much, Aaron. Let's open it up now to Jen and Isobel to talk through the role of families when someone is in long-term care and the challenges being faced. Isobel, maybe we can start with you.
Well, I think, and Aaron had some specific questions related to one of our reports. So I think when you look at who is living in long-term care, first of all, everybody isn't the same. Some of the people who live in long-term care don't actually get any visitors. They never got any before COVID. The visit restrictions, sadly, had no impact on them because they never had visitors. But there is that group of people for whom they had daily visits or fairly frequently many days in the week visits from their adult child, from their spouse, and those visits stopped. One of the things that became clear in our survey that we did for the report, and I think Aaron can identify with this, is that we focused a lot on the deleterious effect to the residents. Very clearly, that was measurable in our increased use of antipsychotics, in our assessment scores. But there was also an impact on the people who could no longer visit, particularly on the spouses, the older spouses. And that I think that in some cases, that may have had a more profound impact on the spouse who was no longer able to visit than the spouse who was in long-term care. The decision to have your spouse, or in Erin's case, your mom, but even more so, frankly, just in the living rooms I've sat in over my years, the decision of a spouse to go to long-term care is devastating, right? Because that's who you live with. That's who you've lived with for 50 or 60 or sometimes 70 years. And you sort of made this vow for better or for worse. And now you're going to be separated by them going into long-term care. And the guilt you feel around that, which you compensate by going every day to visit. And now we've said you're not essential and you can't go. And then finally, when you could go, we said you can come for 30 minutes once a week and you can meet in the atrium so we can watch how you're going to interact with your husband. And that's what it was like for a year for people. I don't think, Erin, your history is not going to judge us kindly on this. I don't think we're at a place where we really want to hear that now, because decisions were made with the best of intentions. And that's what I think we need to remember. But we have, throughout history, had egregious public policies that have completely undervalued family relationships. We didn't think it was important for kids to be raised by their mom and dad. We thought it was more important for them to be educated. We thought it was more important to keep seniors free from a virus and focus on the system protection than allowing those family members to get together. So where did the changes start? Well, sadly, we are not where I want us to be around the declaration that every resident at a minimum has one designated essential visitor, so that when you're admitted to a care home and you give the administrator, the person who's the family contact, the power of attorney, the question is asked, okay, who do you want to designate as your essential visitor in the event that visitor restrictions are imposed on this care home? You should be able to name that person. And there's no circumstance, at some point, there could be a circumstance under which no visitors are allowed. It would be rare. There could be an outbreak of some virulent contagious disease. Nobody has an idea what it is. And that is possible, but then nobody gets a visitor. But there should never be a circumstance under which an administrator gets to say, okay, your son gets to visit you, but your daughter doesn't get to visit you. No, if the son, right, we're not there yet. I am at my wit's end to understand why not. On the family councils, I think there is more hopeful progress. I do believe work is being done by the province. I do believe there is a commitment. And what we would do is, I think the strength in the family councils is that we have to create the forum for the family councils to get together so that there's a provincial voice for residents and families. That doesn't exist right now. We have provincial voices for staff through their unions and their associations, and we have the provincial voice of the operators through the health authorities and through the industry associations. There is no venue for the voice of the resident and the family members. And so a lot of decisions were made in consultation with quote unquote stakeholders through the 2 years of this pandemic. There's not a single stakeholder that legitimately represents the residents and the family members. And I think that the work that's happening now in the ministry is set to fix that. Yesterday is always when you want these things. We're not going to get it today. We're going to have to settle for tomorrow. But I am most hopeful that is coming.
Isobel, thank you. Jen, anything you wanted to add to this?
I think Isobel covered a lot of ground with regards to the challenges facing long-term care, but I go back to my earlier comments. If we're talking about how do we prioritize the challenges facing long-term care in terms of how we go about addressing them, to me, I go back to that fundamental point of this is supposed to be a system in service of the people it serves, not the other way around. So if we're talking about prioritizing the challenges, to me, fundamentally, that means talking with, engaging with meaningfully the families of those with loved ones in care and the people in care themselves to the degree to which they are able. It's the foundational approach to person-centered care, nothing about us without us. And that's the piece that I go back to. If we're talking about prioritizing the challenges, I go back to, and Isobel made this point, engaging the people who are actually engaging with the system itself. So, I think that's critical. And Isobel talked about the role of family councils. I think it's interesting to note that presently the way the legislation is framed, it's something that can be put in place, but it's not something that's required. And so I think that speaks volumes about how we view or value the engagement and participation of families in the system writ large. And I don't want to paint everybody by the same brush, because I recognize that care providers have a lot on their plate. And there are some care homes that do an excellent job of engaging their families, but it's not across the board. And we see that inconsistency in terms of how the essential visitation guidelines are interpreted. We've actually seen a number of people post their comments, their experience with regards to that. To Isobel's point, that's one of the reasons why the Office of the Seniors Advocate, why we at the Alzheimer's Society of BC, and quite frankly, we've even seen BC care providers come out with the same message to say, take the guesswork out of this. It's a really simple, everybody gets one. And I would say too, it's unfortunate we even talk about everybody getting one, because going back to my earlier comment, the families themselves and the person in care themselves should be able to make that determination as to what's appropriate, recognizing that there's give and take. But in some cases it may be that there is one person. In other cases it may be a designation that's shared between a husband and an adult child, or a wife and a sibling. So I go back to my original points of, if we're going to talk about prioritizing, we need to talk to the people who are actually affected by the system.
Thank you, Jen. How do we address the massive costs, financial hardship, stress, time, lost moments together that families with someone living in long-term care have had to shoulder because of the pandemic? Isobel, we'll start with you on this one.
The thing that I believe most people will say was the most difficult was the time lost, and it's the one thing we cannot remedy, unfortunately. The money question is to some extent easier to solve. What you can't solve is the final year of someone's life where they didn't get to spend meaningful time with their loved ones. No amount of money is going to give that time back or compensate for that. But when we talk about the real costs of caregiving, whether it is in long-term care, and a lot of families provide and pay for additional supports for their loved one in long-term care. A lot of families will pay for a companion to come in. Don't forget, there's a lot of people in long-term care who have very loving family members who live in a different city and can't come to visit them every day. And so so how do we compensate for that? And particularly in the community, the costs of caring for your loved one in the community. I keep coming back to when our system is designed so that we, the system, control everything, and we don't. Rapid test is a classic example. We've not given. You cannot get a rapid test in BC without the system, without going through the system, and the system will decide whether or not you can get a rapid test. It's that same thinking and philosophy that we are applying to all the other services, rather than making a global assessment that you're going to need these. And for some people, they are going to need the system to do everything for them. For other people, it's going to be more effective, less frustrating, and arguably less expensive to the system to provide them simply the financial resources to do it themselves. And we resist that. It's not just BC. It was there was a study done in Europe. There were two groups of people, the group of people who were provided with the money to go and get their own help, and the people who were provided the help by the system. And they were surveyed as to their assessment of the quality of care they received. And they found that this group over here rated the quality of care they received as higher than the group who got it from the system. And so our response to that wasn't to say, oh, well, maybe there's something to this. Our response was to say, well, this group over here must not understand what quality really is, or they don't realize they're not getting the quality that they would get. That was the system's response to this. And I think that that is very telling of how we confirm it. When we hear information that doesn't conform with what we think, we dispute the accuracy of the information we're receiving. And that, I think, is very challenging. But for a lot of families who want to care for their loved one at home, and they have the family is willing, everything is there, we do a very, very poor job of coming in and saying, okay, here's what we need to do to make this work. Here's the piece. I'm going to do this for you. I'm going to get all of this set up for you. Here's the financial assessment. You're going to get this much money each month to help you pay for it. And I'm here to get it on the tracks, and then you'll be able to take it from here. That's what we need to have. We think we have it. That isn't what we have.
Thank you, Isobel. Jen, anything you'd like to add on this?
I think Isobel did a great job of covering the key issues, and I kind of go back to the initial point around, the pandemic didn't necessarily reveal new things. What it did is it made obvious what was already there. And so ultimately, when I think about the cost, the time that people will never get back, the financial challenges that people have experienced throughout the pandemic, the disruptions and availability to the supports that caregivers relied on so that they could be there for their loved ones, the isolation, et cetera. My sincere hope is that we genuinely learn from what has happened over the course of the pandemic, and that we are open to the lessons that we receive. Because to Isobel's point, there's no point in engaging in an exercise of learning if we interpret the data through our own bias and reject what doesn't fit with our model. So that would be my main one.
Thank you, Jen. And I think we've mostly covered this, but I'll mention it because perhaps there's a bit more we can expand on. But to Aaron's last question, Isobel, your report, Staying Apart to Stay Safe, put forward recommendations, including the need for everyone in care to have that one essential visitor, and for a family council to be struck to ensure their voices are heard. Could you walk us through the benefits of these recommendations?
So I think the designated essential visitor, I think we understand now the importance of that. We didn't understand the importance of it before the pandemic. It's an interesting thing. The 5-year average before COVID of outbreaks declared in the province each year was 211. And during the first year of COVID, I think we had 236 outbreaks. And in some of the years prior to COVID, we actually had more outbreaks than that in a given year. But the world didn't stop with each one of those outbreaks, and it wasn't a news story, and we didn't report on it, and we handled it differently and all the rest of it. And so, we didn't think about not every outbreak results in closure of visitors. So we didn't really think about this essential visitor piece, right? It became evident when we had this province-wide edict that we're going to close all of our care homes. And it starts with the label visitor. A husband doesn't visit his wife. You don't visit your spouse. That's like the dad that says he babysits his own kids. And that's actually pretty common. But you don't babysit your own kids, and you don't visit your spouse. And so I think, an essential, I'd like us to use a different word, but at the end of the day, I'm not going to fuss about the nomenclature. It's going to be that everybody, when you move into long-term care, that if your husband or wife says they're going to come to see you every day there. We had a situation over here in Victoria. I don't know how many people would have heard the story, but this man had placed his wife in long-term care, as you can imagine, a heart-wrenching decision. And he went to visit her for something like every day. So for 234 out of 235 days, he went to visit her, except for on Remembrance Day. He was a vet, and then on December 31st, we said, you're not essential. And suddenly he couldn't see his wife. Imagine how that wife feels, not really understanding what's going on. And this man who came to see her every day suddenly can't, the man that she woke up next to for 70 years and who at least came to see her every day now isn't there. What's happened? Like, just we just have to think of it in those terms. And that's what we did, because we decided that he wasn't essential. It's wrong. It's as simple
Isabel,
as that.
thank you so much. We are getting close to the end, but I would like to try and squeeze at least one question in here. And one I've just seen comes from Laura. She asks, what are some of the practical ways or promising approaches you recommend to address or overcome stigma? Jen.
It's a great question. And I want to put a little bit of a shameless plug, and I'll get back to this in a second, a shameless plug for the survey that you guys will be invited to complete and to share with regards to the issue of essential visitation in long-term care, because it's related to the answer. We talk about stigma. There is the big A, advocacy, that we can do. So the work in terms of like what Aaron was writing in the chat there, connecting with your MLA, writing letters to your elected officials, engaging in the discussion. But there's also the small A, advocacy, that we can do. For example, if you're a business owner, there's a great resource called Dementia Friendly Canada that you can, it's free courses, you can get it, it's available through the Alzheimer's Society, and you can make your business dementia friendly. That's a way of addressing stigma. The small A advocacy, the lowercase a advocacy, when it comes to just being open and supportive of the people in your life who are affected by dementia, because chances are, with 70,000 British Columbians living with a diagnosis of dementia, you know somebody. Maybe you don't know that you know, but you know somebody who's affected by dementia. So I would say it's the big A advocacy and it's the small A advocacy that we can engage in. And there's some great resources. And if anybody's interested in learning more, I really encourage you to get connected to us via First Link. And even on the Alzheimer's Society BC's webpage, there's a great subpage on advocacy as well that has specific takeaways that you guys can engage with as well.
Thank you to everyone answering the poll and sharing their thoughts with us today. I'd like to invite Isobel and Jen to share some final remarks. Isobel, perhaps we can hear from you first and then over to Jen.
Well, I just want to start by thanking everybody who has joined in this session today, because it shows that you care. And that's going to be important in order for us to move this forward. And I really do want to thank the Alzheimer's Society of BC, Jen and her team, for not just hosting this, but for all that you do all of the time, and particularly all that you do during the month of January. It's very important. And I think when we think about the stigma attached to dementia and Alzheimer's, really, the overarching stigma is ageism, and they are inextricably linked, because there's a whole bunch of people out there who think simply by being old you have dementia, and if you have dementia you are old, and neither of those actually are true. Absolutely, you can be young and have dementia, and you can be old and not have dementia. And I think that it is just more around continuing to push the boundaries around tolerance. And we've seen it. I am hopeful, because if we think back over the last 50, 60, 70 years, and we think of how society viewed and marginalized certain groups in our society and the progress that has been made, you are hopeful for the future that we can make that kind of progress as well against the stigma and the ism of ageism that exists out there. More and more people are going to get old and older, and they are going to find that they feel and are just as vibrant, have just as many things they want to do, feel no different when they wake up and they're 75 than when they woke up and they were 25. And they're going to push the boundary, and they're going to look back at these people behind them, and they're going to say, just wait, this is you one day, and you're not going to feel the same way when you're here that you feel about me today from where you are. And I think that that is how things will improve, and we will embrace the natural process of aging, and that at the end of the day, no matter what age we are, there's a tomorrow, there's something on the calendar to do, and we are going to get out there and do it.
Thank you, Isabel, and over to Jen for some final thoughts.
Thanks, Jordan, and thank you so much for your thoughts on that one, Isabel. I think that's a really powerful note to leave off on. And I also want to say a special thank you to Erin and Myrna for your advocacy on this issue, and to everybody else on the call who's been engaged in capital A and lowercase a advocacy on this issue. It's so important. A couple of key reflections that I took away from today was the fact that people living with dementia are people. And if we can keep that lens to all that we do and how we approach everything in our society with regards to creating dementia inclusive societies, that will serve us well. And I wanted to reflect on Erin's comments, talking about what joy looks like. The antidote to loneliness, the antidote to isolation is connection. And that's what families offer in spades. So it's so tremendously meaningful to the Alzheimer's Society BC to have all of you join us here today. So thank you to all of you who joined us for this important discussion. Thank you again to Erin and Myrna for sharing your stories, and thanks to everybody who shared their stories and their experiences in the chat. I will mention again that we are launching a survey today to learn more about people's experiences of long-term care restrictions that are currently in effect. So please do feel free to share that amongst your networks, respond as you see fit. And once again, thank you all so much. This is an important conversation to keep having as our world changes.
Jen, thank you so much. That is all the time we have for today. If you do have a question or a concern that hasn't been addressed in this hour, I'd encourage you to email advocacy@alzheimerbc.org to share your stories and experiences. As Jen mentioned, the Society is launching a survey looking at people's experiences with supporting family members in long-term care, specifically related to the visitation restrictions. We will put up a link to the survey in the chat box and on a slide at the end here. I would encourage anyone who is supporting someone in care to fill out the survey so that we can all learn about the diverse situations that are happening. On a quick personal note, I'd like to thank all of you. As a journalist, you've given me some great ideas and themes that I think I should be taking back to my newsroom of stories that have perhaps been undercovered. So I thank you for that and allowing me to listen and learn from all of you today. I'd like to briefly pass the microphone over to Amy McCallion, Chair of the Society's Board of Directors, for some closing remarks.
Thank you, Jordan. And a special thank you for being such a wonderful host today and moderator, and to Global BC for being so dedicated to helping us spread our message. Special thank you again to Isobel Mackenzie, Myrna Norman, Erin Craven for all taking part in today's event. We just so appreciate your time and your insights. As well, thank you so much to each and every one of you who've participated today for joining us for this important conversation about an issue that affects so many families across the province and frankly across the country. We hope that you've learned something from the discussion today, and if you'd like to learn more about advocacy, big A advocacy or little a advocacy, we encourage you to visit the Society's website at www.alzheimerbc.org. You can also always call the First Link Dementia Helpline for any information and support you might need. And again, thanks from everyone at the Alzheimer's Society of BC for being part of this event today with us.